What's up, everybody? This is your boy Uber Hikari, aka the Nerd Nigga, here to bring you another video with no frills, just the analysis. And you can probably tell already, based on the title of this video, that it's going to be a serious topic I have to talk about today, ladies and gentlemen. Obviously, everyone wants to know what happened, Uber Hikari. Why have you been gone for so long? What was your Togashi-like hiatus about? And as the title of the video suggests, it was mainly about two things. One, I had very severe psychiatric mental illness. And two, that psychiatric illness caused me to be homeless for a prolonged period of time. So that's basically the quick answer. But I would like to take this opportunity to talk a little bit more about my story. Of course, this is my story. This is not anyone else's story. So just keep that in mind. And also, I want to go a bit more in depth about my story simply because I think it's a serious topic that needs to be addressed for several reasons. First, I want to be able to combat the stigma associated with people who have a mental illness. That's a very prevalent problem for society and for a lot of people within society, especially within the African American community. Again, this is just my experience, so maybe other people have a different experience, but from what I've been able to gather based on my own experience, the stigma associated with mental health disorders is very extreme within the African American community. Also, I think this is an important topic because obviously it touches on life and death. I mean, for people who have a severe enough psychiatric illness, it could lead to suicide or even suicide attempts. And obviously, if I can get my story out there and help someone, then perhaps maybe I could save someone's life. Also, another reason why I want to talk about this issue, I think it's a serious topic to discuss because I personally know people in the YouTube anime community who have a mental illness or who suffer from a mental illness, and I want to be able to at least get my story out there to be able to let these people know that they're not alone, that there are other people like them, and this is my story. So it's also to, in some way, in some small way, to lend some courage to these people. And again, I have to say, this is my story. I know a lot of people are going to get confused about this point, but I really want to make this point clear that this is my story. These are my experiences. These are based on my opinions, and nothing I say here should be construed as the ultimate fact or the ultimate truth about all things mental health disorders. And one last preliminary thing before I get into the nitty-gritty of this video. I've already alluded to this in other places, so even though I don't have to make this video, I feel like I've already opened the door. The cat's already out of the bag. I've already talked about this issue on Facebook, specifically in the J Room, but also in other places on Facebook, and also in the J Room live stream. So if you've been watching Rami Akujotin's J Room live streams, you've probably heard me already talk about this. So with that being said, let's get into the heart of this video. So first of all, what is a mental illness? Because I know a lot of people might be a little bit confused on this point, or might not quite understand precisely what a mental illness is. So a mental illness, simply put, is a persistent behavioral or mental pattern that causes some social dysfunction. In other words, you don't quite have a mental illness until you get to the point where it's so severe that it causes some significant dysfunction within your life. And that significant dysfunction component is the most important component. So how are mental illnesses grouped? So they're grouped by um, personality disorders. An example of a personality disorder is BPD, also known as borderline personality disorder. Another classification of mental health disorders are mood disorders. So things that affect whether you're happy or you're sad or what your mood is. Things like major depressive disorder. Another classification is anxiety disorders. So these are things like generalized anxiety disorder, PTSD, those types of things. Another classification which people don't really talk about all that often are eating disorders. So eating disorders like bulimia or anorexia nervosa, also classified as mental health disorders. And then the final classification, the fifth one, is substance use disorder. So these cover everything related to some sort of addiction. So that's specifically what a mental health disorder is, and those are the classifications under which mental health disorders are grouped. All right. So in terms of my personal family history, um, these things, I mean, almost all the groups I just named, all the classifications, are prevalent within my family except for eating disorders. I don't really know of anybody in my family who has an eating disorder. But in terms of everything else, those things are very prevalent within my family. And this is important because people have to understand that a mental health disorder has generally two components. There's some genetic component with respect to heredity, your family history of mental illness, but the second component is generally environmental. So there has to be some environmental trigger which creates the conditions for your genetic predisposition to manifest itself. So first you have to have the genetic component, which is the genetic predisposition, and then there's an environmental factor which makes that genetic predisposition manifest itself. So just very briefly to talk about mental health in my family. In my immediate family, which covers my father, my mother, um, my brother, my sister. Let's see. My father, me, my brother, and my sister. So 4 out of those 5 have some sort of mental health disorder. And then it gets even deeper than that because on my father's side, just looking at my father's side now, um, his father had a mental health disorder. Of course, he had a mental health disorder. And my grandparents on my father's side had 9 kids. And of those 9 kids, 5 had some sort of mental health disorder. So you think of my grandfather, my grandmother, their 9 kids. That's 11 people in total. And of those 11 people, 6 have some sort of mental health disorder that ranges from everything from substance abuse to mood disorders to anxiety disorders. So that's just a brief summary of my family history. So I won't say I was destined to have a mental health disorder, but given my family history and my family background, it was very probable that would happen. So specifically, what do I have? I have 3 diagnoses. The first one is bipolar disorder NOS. The NOS stands for not otherwise specified. So bipolar disorder is a mood disorder characterized by elevated moods, so generally very, very happy. And there's also some psychotic features of that elevated mood and also depression. So it has 2 components. 1, very high, very elevated mood, and 2, very low mood or depression. And there's three types of bipolar disorder. There's bipolar 1, which is depression and mania. So mania is you you have very high energy. You're generally not sleeping. That sleeping causes some psychotic features to arise. So it's depression and mania. And generally, the depression and the mania, um, it cycles. So for maybe a couple of months, you'll have mania. Then after that, for a couple of months, you'll have depression. Then for a couple of months, maybe you'll be completely normal. So it just cycles back and forth. Bipolar disorder 2 is depression and hypomania. So hypomania is just a less severe form of mania. And you just cycle back and forth again between being normal, between hypomania and depression. Bipolar disorder NOS, however, uh, it's it's basically a diagnosis that psychiatrists have because they don't really understand uh, quite what's going on yet. They don't fully understand mental health disorders, and they don't fully understand bipolar disorder. So everything that doesn't fall within the category of bipolar 1 or bipolar 2 is kind of left for bipolar NOS. For me specifically, I have hypomania, I have depression, and instead of cycling every couple of months or every several months, my mood fluctuates more rapidly. So it can fluctuate as quickly as several times within a day or within a week. Always cycling back and forth between being normal, between hypomania and depression. So bipolar disorder 1 and 2 generally cycle every several months. But bipolar disorder NOS, for me specifically, cycles much more quickly than that. My other diagnosis, my second diagnosis is PTSD, which is an anxiety disorder that's generally caused by some extreme form of trauma. So some form of childhood abuse, being in a situation where your life is at risk, and it involves symptoms like panic attacks, depression, extreme depression, and it's also interesting because sometimes psychiatrists have difficulty distinguishing between one mental health disorder and another one. So, for example, um, major depressive disorder. Major depressive disorder is depression, but just stretched out over a prolonged period of time. But there are other mental health disorders that also have depression as a feature of that disorder, like I just explained bipolar disorder, or like I just explained PTSD. So it's kind of difficult to distinguish between those symptoms of different mental health disorders. And in my particular case, because I have both bipolar disorder and PTSD, I was initially diagnosed with bipolar disorder, and they didn't catch the PTSD until much, much later, because it was just difficult to distinguish between the symptoms of the PTSD in some cases and the symptoms of the bipolar disorder. All right. So now that I've explained what a mental health disorder is and my specific diagnoses, let's talk about my experience with having a mental health disorder, and living and not living but coping with the symptoms, as people in the community like to say. So I was initially diagnosed with bipolar disorder when I was 15 years old. That was the first time I was hospitalized for a suicide attempt, and there were red flags throughout my childhood. Um, Most of the time, psychiatrists or psychologists don't like to diagnose um, a psychiatric illness at a young age, simply because they're wary of categorizing someone at such a young age. But there were red flags all throughout my childhood. I mean, I remember having a panic attack as early as, I don't know, how old are you when you're in kindergarten? 5? I mean, so there were red flags throughout my childhood. And the biggest problem was that nobody in my family was educated about what a mental health disorder was. And so they just didn't have the ability to understand those red flags and figure out precisely what was going on. But even after I was diagnosed with bipolar disorder when I was 15, um, I still never really got the family support I needed or the help I really needed, mostly because my family was just in denial. I mean, when someone tries to kill themselves, especially when they're 15 years old, it's a I mean, a huge catastrophic event within a family. And the way my family tried to deal with that was just in denial. My mother told me that mental health disorders weren't real, that it was just Satan playing tricks on my mind. My brother told me that, you don't have a mental health disorder because you're too intelligent. Intelligent people, smart people, they don't get mental health disorders. My sister said I was faking, it wasn't real. The doctors must be wrong. I'm just making it up. I'm making excuses. And so as a result of that, I never really got the help that I needed. My mother never really encouraged me to go to my doctor's visits, never really made sure I was taking the medication I was prescribed. And as a result, the symptoms just snowballed and got worse and worse over time, to the point where, um, I think 2012, I was 6 credits away from graduating from Rutgers University in New Brunswick with my BA. And at that point, my psychiatric symptoms were just so severe that I had to drop out of college. I came home to live with my mother, and eventually she kicked me out because she said mental health disorders are not real. Uh, you must be lazy. You don't want to work. And because my mother didn't really understand what a mental health disorder was and never really took the time to educate herself, um, this seemed like a legitimate response to her. You don't have any problems. You're just lazy, and if you're lazy, then you can't live here. You just got to get out of my house. She kicked me out of the house. And it's a little more complicated than this. My relationship with my mother, because my mother is at least partially responsible for the mental health problems of all of her children. She was extremely abusive physically, mentally throughout all of our lives. She had 3 children. She abused all of them. And when I left the house, when she kicked me out of the house, she told me straight up that I don't care whether you live or die. I don't care anymore. Just get out of my house, and that's the end of it. As a result of that, and basically being ostracized by my family, like I said, my brother and my sister were both in denial about the fact that I had a mental health disorder, so they weren't willing to help me at all. And so as a result, I was homeless for 17 months. Um, Sometimes I had to sleep on the streets, literally. But most of that time, I mean, of course, being homeless is bad, but most of that time I was living in homeless shelters, which of course are terrible, but not quite as bad as sleeping in Penn Station, for example. Um, but here's the important thing you need to know now. Um, I got the help that I needed. I was able to go to a very great psychiatric program that helped me manage my symptoms and cope with my mental health disorders. So I got the help that I needed. Now I go to outpatient at a psychiatric facility once every 4 to 6 weeks, just to make sure I'm managing my symptoms properly and to make sure I have all the medication that I need to manage my symptoms. I have my own apartment right now. So anybody who was thinking that Uber Hikari is homeless, no, it's not like that. Like I said, I got the help I needed. I have my own apartment. and all of my bills get paid every month. So although I went through a very difficult period for that prolonged period of time, that 17-month stretch, right now everything is pretty much okay. The only problem I really have right now is that I'm unemployed, so I'm looking for work. So that's pretty much it. So now I would like to take the time to talk about my recommendations for anybody who has a mental health disorder or a very severe mental health disorder. So the first thing I would say is that if you have a severe psychiatric illness, the first step is to be honest with yourself. Be honest with yourself about the fact that you have a mental illness, and don't stigmatize yourself, because this is a very prevalent problem for people who have a mental health disorder. Because society stigmatizes people who have mental health disorders, the people who have those mental health disorders in turn stigmatize themselves. They tend to see themselves as defective, that they're not good enough, that they're not worthy enough, that this is something that they simply can't overcome. And even right now, I have a friend who's going through this right now. I'm trying to help them through this, but it's very difficult. So I would say my first recommendation is to just simply be honest with yourself, and don't look at yourself as somehow being defective. Just don't stigmatize yourself. And I know that's easier said than done, but I think that's an important first step to at least mention. The second thing I would recommend is get your support system involved early. And by support system, I mean family and friends. For people who have a mental health illness, it's extremely important for your friends and your family to be behind you, to support you, to understand your illness. Because if you are associated with people who don't understand those things, eventually, it doesn't matter if it's in 1 month or 1 year, eventually those people are going to drag you down. And I can say that from my story, from my experience. Eventually, my mother, my brother, my sister, they all had their own ideas about what a mental health disorder was. They were not involved in supporting me. And as a result, it negatively impacted my ability to deal with the mental health disorder. I wrote this in a post in the J Room Facebook group. I said that mental illness manifests itself as social dysfunction, and therefore it requires social remediation. That means that because your mental illness manifests itself as some sort of social impairment, that the best way to help you manage that is through social support, meaning your friends and family. My third recommendation. My third recommendation is for people to see a psychiatrist rather than a psychologist, or at least make it a priority to see a psychiatrist very quickly if you have a severe mental health disorder. The reason why I say that is because medication is integral to managing your symptoms. And I know there are going to be some people who think that, medication is just a conspiracy by pharmaceutical companies, or that medication doesn't really work. But for me, and again, this is just my story, and not only just my story, let's be honest, the empirical evidence is out there that if you have a severe enough psychiatric illness, then at some point you will need medication to manage the symptoms of that disorder. And at one point, I had to take 5 different medications to manage my symptoms. I mean, I don't take 5 different medications now because my symptoms are managed better at this point, through therapy and through group therapy and through things like that. But medication is important, and psychiatrists are the ones who have the ability to prescribe medication. Psychologists don't. One of the mistakes I made and initially trying to get help for myself was I didn't realize how important the distinction was between a psychiatrist and a psychologist. I mean, if you have a severe mental health disorder, then talking to a psychologist simply won't help you because you need the medication to manage your symptoms, and psychologists simply don't have the capacity to prescribe medication. The third recommendation, or no, the fourth recommendation. So the fourth recommendation I have for people is to go to what's called an acute partial hospitalization program. So if your symptoms are severe enough, this is the type of treatment you will need. So there are different levels of psychiatric care. The first level of care obviously is involuntary hospitalization. This is for people who are, I mean, psychotic, don't know what they're doing, can't distinguish fact from fiction, having breaks with reality. Also for people who like tried to kill themselves, like I did. That's the first level of hospitalization. I mean, the first level of care. That's hospitalization, whether it's short term or long term. This is for people who have the most severe symptoms of their disorder. The next level up in terms of psychiatric care is what's known as acute partial hospitalization, and this is long term. It generally is from 6 to 12 months. It's very intensive group therapy. It's also very intensive cognitive behavioral therapy. It's medication management. And generally, like I said, it's very intensive. So in my case, when I went to an acute partial hospitalization program, I went there for 5 days a week for 8 hours a day. Like I said, I mean, managing a mental illness, or in my case, managing multiple mental illnesses, is no easy task. And sometimes you need prolonged, very intensive psychiatric care to help you manage your symptoms and then reintegrate into the community. So the next level up from acute partial hospitalization is what's known as partial hospitalization. So this is when you reach the point where your symptoms are pretty much completely under control. You might go to the program for only 3 to 5 days a week, and even then you might not even stay for the whole day. You might just stay for half a day. The main focus of a partial hospitalization program is community reintegration. That means getting you housing. A big problem with people who have mental health disorders, as was the case with me, is that since they can't manage their lives, since their impairment is so significant that they can't function, they can't hold the job, that usually means that a lot of people who have a mental health disorder or are also homeless. So partial hospitalization programs focuses on getting people housing, reintegrating them into the community, getting them jobs, setting them up with things like community service. And it's just setting the foundation that you need for long-term stability. And then the final level of psychiatric care is outpatient. Outpatient is for people who basically have no problems managing their symptoms on their own. These are people who can be responsible for themselves. And outpatient just entails that you see a psychiatrist for maybe 30 minutes to an hour once a month, generally. Once a month, or in my case, it could even be a little bit longer, once every 6 weeks. So those are the levels of psychiatric care. So like I said, if your symptoms are severe enough, I would definitely recommend that you try to get into an acute partial hospitalization program. And I understand that may be difficult because psychiatric care in America isn't uniform. So there are some places that just have better psychiatric care or better programs than other places. I was fortunate enough to live in Newark, New Jersey, which is home to the Rutgers University Behavioral Healthcare Center. which happens to be probably, I mean, for people in my position who are low income, who don't have the money to pay for their own psychiatrist or their own programs, it's probably one of the best programs on the East Coast. I mean, it's an incredible program, and it's directly integrated into one of the best universities in the world, which is Rutgers University. So in my case, I kind of lucked out in regard to a pretty good psychiatric program. So that's pretty much it. I just, like I said, wanted to take this opportunity to let you guys know what happened to me during that 2-year period where I was absent, and also give my story so that people could potentially be empowered to not feel so isolated or ostracized or stigmatized. And I just, like I said, wanted to take this opportunity to lend some people some courage. And if this video helps even in a small way, then I did something worthwhile. So this was your boy Uber Hikari, aka the Nerd Nigga. Just brought you another video with no frills, just the analysis. Peace and have a blessed day.